A lot of us cardiologists will use sort of chest pain as our shorthand for any discomfort above the waist. I make a habit in my practice when I ask a patient about chest discomfort, I ask them if they have pain, squeezing, burning, stabbing, any way they could describe it, because a lot of people will say, you know, my chest is tight, but I don't have any pain. Well, that actually can still be angina in the right situation and needs to be investigated. Sometimes the pain is so severe that patients tell me they'll be rolling on the floor for hours thinking that they got food poisoning, and it's actually their heart. So when something really catches your attention, do something about it. And when something is pretty reproducible, meaning every time I walk 50 steps, I get chest pain, I take a breath, I relax, and it goes away, that's angina too, and that needs to be investigated.
Chest pain is a very common symptom. We see it in all kinds of patients in all kinds of forms. It can be described as a burning sensation, a tightness, a pressure. Some people have a heartburn type symptoms. Sometimes people just have shortness of breath or fatigue.
It can be caused by a variety of reasons, including things like angina, heart attack. But we also know palpitations can also bring on chest pains. These are the worrying causes, but there are other causes as well. Things like acid reflux can precipitate chest pain. The chest wall itself can cause pain, so we know that the chest is made up of the breastbone and also muscles interspace between the ribs, so the pain can be coming from any of those sources. Chest pain can also be caused by the lungs as well, so that sort of chest pain is usually pain that is exacerbated when someone breathes in or out. But anxiety is another common cause that we see in patients as well.
When you come to the emergency room, you'll be brought back and evaluated by a nurse and physician. An EKG will be obtained as well as blood work, and further tests will be done so that we can get a better understanding of what these symptoms are and whether or not they're truly related to a significant problem like heart disease. If after this evaluation it becomes clear that you are suffering from heart disease, you'll need further treatment. Coronary angiography is a typical treatment plan which oftentimes leads to balloon angioplasty or stenting. Sometimes patients' heart disease is so severe they'll require bypass surgery.